Hello everyone. This is Dr. Cui. So in this video, I would like to talk about what to do after the match. So if you get matched, congratulations. It's a good time for you to have a rest and just relax yourself. But here I want to let you pay attention that it's always better to contact programs in advance to make sure something you need to do before the residency training. So the first thing I would suggest you to make sure if you need a BLS, ACLS, or PALS certificate before the residency, because some program need this certificate uh, um, before the training. So you need to, so it's better for you to contact the program director or program coordinators in advance to see if they need this. And if really need it, I think you need to spend some time to get familiar with those exams and in order to pass the exam and get the certificate. And also it's a good time to recharge yourself. You need to, it's better for you to take some time each day to review the old knowledge and to learn some new knowledges. And I would suggest you to learn some practical knowledge during, especially for the clinic rotation. And for example, it's better for you to learn how to interpret the EKG and how to use the electrolyte to give the patient rehydrate the patient, and how to calculate the input and output of the patient, something like that, and also update your knowledge every day. So learn something new from the textbook or any study materials, and also it's always better to practice some skills for resident or the future clinic rotations, like how to admit the patient, how to use the new EMR system, uh, how to learn some clinic skills, how to apply the knowledge from a textbook of the clinic skills to the real practice. So it's always to learn something new, and also uh, how to use the abbreviation of the prescriptions, how to know those abbreviations, the meaning of those abbreviations. So it's always better to get familiar with those new knowledges in advance, which will give you an easier life during the residency training. And also remember that you still need to pass step 3 and ITE exams each year. And at the end of residency training, you need to pass the board exam. So that's why I strongly recommend you to take some time each day to learn some knowledges or review the old knowledges from textbook. And also, and apart from the studying, you also need to prepare for moving, including the housing and the driver, and probably you need to get a new driver license or renew a driver license, something like that. So before starting your residency training, and just to make sure that everything will be set up before the training, or in order to make your life easier. And if you want to apply for the fellowship in the future, and I would say that it's also a good time to consider about doing some research. Because the residency is busy and only 1 month is protected each year from the ACME for you to do some research or other extracurricular activities. So basically total 3. So basically only 3 months is available for you to do some research in the residency training, which is too short. So that's why I recommend you to take some time to do some research before the residency training if you want to apply for the fellowship, because the research is very, very important for applying the fellowship, especially for those competitive subspecialties like cardiology or GI. So that's all of suggestions I can give to you. And always bear in mind that you want to become a doctor. So the match is just the beginning. So good luck.